He has his master's degree from Andrews University and is our senior pastor. We love having him here. Elder Kennedy Dulo is next, one of my fellow elders here. And he's in charge of our community outreach and does a lot of work with that. Marge Hay is my cohort, my fearless partner as the co-health ministry director here at Worthington. And then Lulu, we know, as I introduced earlier, is from the African SDA Church and works with their health ministries department and runs a very tight ship over there and does a lot of work. So I'm going to I want to go around the circle once for you guys to introduce yourselves. I know that I just did, but I want you to be able to share at least one thing that you think you've gained from being a health ministry leader, and one sort of thing that you feel like that you've been blessed by as being a health ministry leader.
Okay. Sorry, man. I don't know. This one.
Check. Oh, tell you what, we'll give you this one.
Not to worry. Hi. So as Dan said, I'm Jenny Thord. I'm Dan's wife. I do a lot of the I'm in charge of a lot of the kitchen stuff, so a lot of the cooking, recipes, cooking tips, all that kind of stuff for a lot of our health programs. So if you have any questions about sort of cooking classes or recipes or anything like that, I'm probably the girl you want to talk to. And so that's probably where I've gained the most out of working with health ministries, is learning how to cook new things and how to teach other people how to cook them. So that's what I like to do. So if you want to talk about that at all, talk to me.
Again, my name is Julian, and if you're a health ministry leader in your church, you have to get your pastor or pastors on board. Your health ministry is not going to be the same without him being on board. He has to be there when you do things with your people who are participating. For them to get to know him is really important. That gives the message, this is not just a theory, these people are really involved. Besides, the pastor will have the chance to connect with these people and invite him to church in a way that most people will probably not be able to. So get your pastor on board. I personally am so grateful that in the beginning, the health department, they waived the fee for me to join CHIP. I was a little bit skeptical because even though I have been vegetarian for my whole life, I said, I don't need that. I'm a vegetarian. I mean whole life, my whole Adventist life. That means 24 years. So when I joined CHIP, and they took my cholesterol right in the beginning, and it was 194-ish or something like that. And I said, whoa, that's high. I'm supposed to be way low, below that. So, and at the end of CHIP, I dropped around 30 points just in a month. And then last year, when we were doing our health expo, I did it again, just to see my cholesterol, and it was 130.
Wow.
So CHIP works, guys.
Wow.
Kennedy Dulo, elder at this church, Worthington Seventh-day Adventist Church, and mine is community outreach. This is something that I've done for about 18 years in this state, cause this city, and so I consider it my calling. But it's only last year that Pastor Julian asked me to officially be the community outreach director for this church. Now, I don't think we had that position before, but there are several community outreach programs and events going on in this church, and so what I'm doing is just to step on other people's toes and interfere with what people are doing, but at least now officially go out there and can speak on behalf of the church, continue doing what I'm doing, and also speak on behalf of the church, and also report back to the church what's going on in the community.
I'm Marge Hay, and I'm the Health Ministries Coordinator for this church. That's my title. However, Jenny is the Chief Organizer for our church.
Here.
She does all the footwork, and Dan, as you can tell, has all the energy and ideas. So, and they're just a part of our team, but they are the biggest part of our team. I could talk a long time because I've been involved in all these different things at our church, but I'll just say we've done a lot of discouraging sort of about CHIP, and it's not something that you would do in a small church for the first event. But it is, if you ever do it in partnership with other churches or something, perhaps one of the most rewarding things that you'll ever do, because CHIP is designed for sick people. It's not designed for healthy 20 or 30-year-olds who just want to know how to eat. That's full plate will do that. But CHIP is designed for sick people, and when sick people come to CHIP and they commit themselves, to the program, they see results. And we've had lots of people from our church who say, oh, I've been an Adventist for my whole life. Oh, I've always been a vegetarian. Oh, I never knew that. It's just amazing, just amazing. And we have one guy in our church, he's not old. Dave, how old is Dave Abbott? 50s. He's had a few bypasses and a few stents, and he's 50, and he's diabetic and a few things, and he finally came to CHIP, and he got almost all off his insulin. He did, and he's a good advertisement for us. So we've had a lot of people with a lot of success, and it is very rewarding. It is very intense. Full plate is a fun thing to do, and I'll answer questions about that if you want. And Dan didn't mention the advanced directives piece that we did, but ask me about that later.
Oh, that's right.
Hi, I'm Lulu Manungo, and I'm the Health Ministries Director at it's now called the All Nations.
All Nations Church.
Yes, Seventh-day Adventist Church. So, yes, we just had a name change. But my background is actually in public health, and I've got a master's in public health, and I love, love, love working with people, developing public health programs. What I've done more of is HIV and AIDS prevention programs. But at the All Nations Church, we have conducted a few, almost about 4 health expos a year. But we started more with the in-reach before we went out into the community, because it's really important to have a healthy church before you go out with your church to say, okay, let's get healthy, because everyone is going to be like, these people who are telling us to get healthy, how come they don't seem like they're healthy? So it's really important to do the in-reach first. But again, I'll be happy to answer any questions you have.
Just wanted to say something about Lula's comment about your church. If they're not healthy, if we are not healthy. I remember at the last year Health Expo, my wife and my daughter, we were volunteering, we went out on a table in front of the convention center to eat our lunch. And lo and behold, of these thousands of people who saw us there and knew, they came to us and they literally checked and said, let's see what you are eating. We want to see if you're really following what you told us we should do.
That's true. Lulu, could I ask you to share just a little bit about the collaboration between our 2 churches last year and how we came to work together, and how we worked together to pull off an event of the size and scale that we did?
Oh my. So we had been conducting quite a number of health expos, like I said, about 4 a year since 2010. And we worked our way up, and I liked the comment you had earlier on about you need to start small. You really cannot start big. It's not good for you to start big. Why? Because you need to learn the ins and the outs first before you just have a really big program. So we would be invited to walk to the Y at the Call Road Library, close to the Call Road Library. But we had that, and so all these expos then led up to this big one we had. So what happened was, because we were a small church, we thought, okay, we just don't have the human resources. We would want to implement a huge health expo, but we just don't have the resources. And we actually just wanted to just have a general health expo. We didn't even know that we would have something as big as the 10 TV, but Pastor Julian and Dan then told us about the 10 TV expo, and we we came together as a team. Dan has, I think, a long list of volunteers that you have an email list.
Mostly from Chip, honestly. We have a long list because it takes so many people. So we have a long list of people to pull from.
Yes, and it's really important to have people who are helping out at these health expos. And I know I keep saying health expo, but what the Health Expo is just really conducting an event that deals with all the areas that you heard about, which, New Start. So nutrition, exercise, water, temperance, all the way to trust in God. It's important to have a comprehensive program because screenings are important, but they're not the end. And so we then, we started these, or we have continued these expos that have been started, by other people. But the point was, we need to get to more people within the community. And 10 TV was definitely a way, the 10 TV Health Expo was a way to get into the community, make ourselves known as the Adventist Health Ministries. It's, I think one last point I'm just going to make is, you can't do it as one church. I think it's very important to collaborate. A lot of people are doing individual things, but we are stronger if we actually are together and do these programs together.
Amen.
And may I say something in regard to the collaboration of different churches? Probably you say, some of you may say, we are a small church. But if you think about it, let's say if all the churches in the Toledo area or all the churches in Cleveland area came together, how much you can offer. And at this event, the last station, the Trust Station, is also the station where you offer people some literature, like what we offered was Steps to Christ and a few other brochures, but you also talk with them. Go over their results and tell them, encourage them to follow up on that. And ask them, what are you interested spiritually in? What is feeding you spiritually? Because all these things without spiritual health are not going to bring you anywhere. So when they talk with us, with the doctors or with the pastors who are sitting at the last station, we give these people a chance to get to know us and offer them different programs that we offer throughout the year. You open the door for these people to get in the doors of your church, to get to know you better, and to get a different picture of the Seventh-day Adventists, because unfortunately, not all the people out there in the community have a very good picture of us. So
I'm going to switch off my lapel here so I can use this handheld and walk around without getting any feedback. I could ask these folks questions well into lunchtime, so I'm going to stop for a minute and let you all ask one or two questions or more that you've got on your list before, and trust me, if you don't have them, I'll just keep going because I've got tons of them. But is there anyone who has a question that they want to go first? Here we go. Go ahead and tell us who you are and where you're from as well. Just one at a time.
Okay, yeah. My name is Glory. I'm from the Swanton Seventh-day Adventist Church that's outside of Toledo. And I have a question for you, Pastor. For the pastor that is pastoring numerous churches, and he is pulled in all different directions, and it might be too much for him to come to something that I would want to have at our church because of him being pulled in all different directions. How do we go about that and still encouraging even our members and the community that I don't want to say that we don't need the pastor, but that we don't need the pastor. You know what I'm saying? I want them to still be encouraged, and I want to encourage the pastor to be a part too, but if he is involved with many churches, how do we go about that? What would your answer be to that?
Fortunately, I've been the pastor of this previous district that Glory is coming from. Well, honestly, the best way, and we've done this with other programs that we did in Northwood, for instance, you call the other churches to come and help you. And when the other churches in the same district come to help, the pastor is going to be there too, because all of his churches are involved in that. Basically, you tell him, you don't have any excuse to be somewhere else because all of your church population is at the event. What is your excuse for not being there? So if you involve all the churches and share responsibility financially and also manpower-wise, the pastor is going to be also there, because unless he has a personal kind of excuse to be somewhere else, there'll be no excuse I'm busy with my other churches. Everybody's at the same place.
Here's one more, and I'll go to the next one. You said you had a list, so maybe
I did. I have a question for Lulu. As far as, you said that you had health expos like in-reaching. And did that involve like going through the New Start with the people inside of the church? What did in-reaching involve to make sure that our people are educated in applying these principles?
Okay, so we started off with health corners every Sabbath. So every Sabbath we would have a health talk, something completely different. And what we did was every month we would have like a topic to concentrate on. So January was nutrition, and anyone who's a health professional in the congregation would volunteer either to say something or invite someone else to come in and do a presentation, or they could just do their own presentation. So, and then February exercise. So health corners every single Sabbath, so that there's something that's being said from the pulpit about health. And then the expos themselves were, yes, they focused on New Start. And they were particularly for the members themselves. So the members would go through each of the stations, and they would talk to the people who were manning the stations. So go through blood pressure checks, glucose checks, cholesterol. Cholesterol is more expensive, so we didn't do that as often. And the Harvard Step test, but they would go through all of that. And at the very end, like Pastor Julian was saying, we'd have the Trust in God station. And we invited people. We actually had, I think, a doctor, our very first expo, a doctor from Worthington, Dr. Victor War? Yeah, yes. He helped us with our very first one. And then we had a nurse practitioner, we had the pastor, and they would sit at the very last station, go through all the results of the checks and whatever had been talked about through the other stations, and then just bring it all together for the people in the church. Then after that, there's some people who decided they wanted to volunteer for the health expos themselves. So we used that, the initial health expos to then get our volunteer pool even bigger.
Just to add to what just Lulu said, do some of these screenings for your church members. And when they see their glucose off the chart, or if you can invest at least for your church member to do the cholesterol check, and they see where their cholesterol is, or where they see, let's say, their lung capacity is, it gets you really scared, because you think, oh, I'm an Adventist and I live a good, healthy lifestyle. But when you see the results, there is nothing more motivating than see the results for yourself. Do one health expo just for your church members. Let them see for themselves that it works and where they are health-wise, and then do it the screening, let's say, a few months later after they have done something about their health, and for them to see that the results have been becoming better, and here you have them on board.
So something I forgot. With church members, it's very easy to blur that line of privacy versus, okay, what's public info. It's very important when you have, because when church members are going through these stations, there's certain information that they want to remain private. But other people are, they're saying, what are your numbers? Oh, what's going on? Oh, that's your weight? Oh, no. So we really tried, like you said, you need to keep it professional, friendly, but professional. And just tell them, in certain terms that, can we just be alone with her or with him for a minute, because this is private. And as they go through the stations, just make sure that it's very defined.
I think professionalism is something that's really important. And I hope those of you that can will come back in August to this church when we do the training for the big event downtown. So you can kind of see what that looks like. There is a lot of nuance and to being able to do this well. Lulu does it very well, and we've tried to work together to do it well. So I hope you can come back for two reasons. One, to see the process and see how it kind of works, because the training will be a New Start Health Fair set up here that we can train all the people that will be doing it downtown on what the stations are and how they do it. But it's very important in terms of professionalism. You don't have that loitering aspect, which is easy to happen when you have church members, because you've got the people who are there after potluck, and you've got people who are just coming in to check it out because they heard it was going on, and you've got people who are participants and people who are volunteers. It's very important that there are only two kinds of people at your health fair. The ones that are being trained, or the ones that are being screened, and the ones who are there to work. The ones that are there to talk about everything else don't need to be there at that time. But we can talk more about that in the fall. I'd like to offer, is there anyone else who has questions or has one they'd like to ask? I got one in the back here. Thank you for the mic there.
Good morning. My name is Alan, and I'm from the Lancaster Seventh-day Adventist Church. I'm the co-director of the Health Ministries team. I used to be a drug addict, and I also took some courses in college on drug addiction. So I think this question is aimed toward Lulu maybe, or actually Marge Hay. Our church just recently purchased a 48-week program called Journey to Wholeness. And living in Lancaster, it's a really bad area for drugs. It's considered the heroin highway, Route 33 is. So, and we also did there's a 9-day stop smoking program, which is a little outdated, I think. We had 2 participants. We had immediate 100% success, but unfortunately they both started smoking again. I wanted to know, is there strength in numbers? I mean, should we have more people? What could we do to make this more successful?
That's a good question.
So that's Marge's area of expertise too. Do you want to talk a little bit about what you used to do with the counseling with stop smoking programs?
I used to work with the 5-day plan to stop smoking. Now, that predates most of your lives. That was back in the 70s, 60s and 70s. And it's like anything else. It doesn't matter what program it is, whether it's a stop smoking program or a drug program or a full plate diet or CHIP. The results depend on your investment in the program. And if you're invested in the program and you really want to make a change in your life, the program works. But the result is up to the participant. There's nothing, well, I was going to say there's nothing magic about the program. I guess there are some magical things about the program, but what makes it work is the participant and the participant's commitment. It doesn't matter what it is we're talking about. We used to have a very high success rate in the 5-day plan to stop smoking. It was incredible. We would have 100 people at a time.
Was that at the hospital or here at the church, or a combination of both?
It was at the church. It was at the old church.
Okay.
And we met once a month forever, for years, 10, 15 years after that. And as long as the people came and as long as they were committed, they didn't smoke. Last week, one of the gentlemen who graduated from that program, 2 doors down the street, he died. And I thought, oh my, Dick died. But he lived a long time. I mean, that was back in the 70s, and this is 14, so that's 40 years after he stopped smoking, and he was 40 or so when he came to the program. So it just depends. Same with CHIP. It depends on what you put into it. It depends, full plate. It's up to the person.
Lulu, did you want to comment on that too at all, about the question about smoking programs or any of the cessation programs?
Well, in general, I think because any health program should have an outreach piece, it's very important that besides that program itself, you need to be doing or supporting the people in other ways. Now, if it's only supporting in that one thing, they might feel like, okay, that's the only thing I could go to you for. But if you support the participants in other ways. And I can't come up with anything off the top of my head right now, but even if it's mowing their lawns, or meeting them with or in other circumstances, other instances, then they find that they've got support. They don't feel judged. That's one, and I think another piece. If they don't feel judged by the people who are running that program, then it's more likely that they will first succeed, but also if they do fall, at some point, they're going to pick themselves up again and know that they have support. So that support piece is very important, not only for the program itself, but for other things. Support them in other areas.
The last CHIP program that we did, we had a lady come. Now, I was not impressed that this lady had very much money. It cost $399 just to come to CHIP. She came in a taxi every night from Bexley. I don't know how much that cost her. She was from the Dominican Republic, and somewhat hysterical the first time she came. It turns out her son had just shot a policeman, and he was in the hospital, and pretty soon he got out of the hospital and was in jail. Anyway, it's a long story. But the group supported her through that experience, and CHIP just provided the people, I guess, to do that. And one of the things that we do here, CHIP and Full Plate and those things, we operate very much in a small group model with leaders, with table leaders, group leaders, whatever. And if you investigate CHIP now, they will tell you you don't have to have table leaders, you don't have to have group leaders. Well, the thing that makes the program work is the relationships that you have with the people. So don't let the leaders talk you out of that, because that's very, very important.
I've never been a drug addict, even though I've smoked and I drank, but never used the hardcore drugs, so I cannot speak about that. But I know one thing for sure, whether is it quitting smoking or quitting drinking or just starting eating healthy, there are 4 elements. And the first, which is mostly ignored, is the mental, emotional element involved. Are you really determined to do what you want to do? Are you emotionally and spiritually involved in the decision you are making to quit smoking or drinking or abusing drugs? Then the second element, of course, is changing nutrition and exercise. You have to substitute this void with something healthy. And the final and very important step is surrounding yourself with people who are going to support you in this journey, because you are changing your lifestyle. You cannot do it on your own. God has designed us to be social beings. We need other people to help us through this difficult journey of change. And I think when you do a health program in your church, invite your church members to be there, even though they know everything. They may have been through the program you're doing. They may have been through CHIP or Full Plate. Be there, because you are the support group of these people who are about to make a change in their lives, and they cannot do it on their own.
My wife stepped out to help with the caterer get set up for lunch, so I passed the microphone off here to Pastor Mike. So if you guys have questions, we'll keep answering them here for another 15 or so minutes, and then move into our closing right before lunch.
When you say that Worthington and the All Nations Church are small churches, what is small? Like, how many people, active members, do you have in your church, and how many people do you need on your health ministry team to really get it started?
Well, Worthington is probably one of the 2 or 3 largest churches in the Ohio Conference. We have about 800 members. We have got 3 or 4 churches around Columbus that have been planted because of Worthington. For example, the Spanish church, which now meets at the Westerville building in the Westerville church. So our membership will fluctuate from 800 to 1,000 plus, depending on, because I think that church is several hundred members now, the Spanish church, when they broke off from us. So our membership, and they were under our church membership till they became their own church. So our membership is about at that level. Our church, as you can see, is a team of probably 3 of the, Jenny and my wife and myself and Marge, and then beyond that, a bigger team of both pastors, Kennedy and his team, and then on a church on our scale, you probably need a group of at least 3 committed, and then 4 or 5 more. Lily, do you want to talk about the size of your church and how many people you have working with you?
So we're probably like 50. We've got 50 active members, and then, give or take, but about 50. And because we are now running bigger health expos, we do need a team, I think about 3 committed people. But besides that, for the health expos themselves, you're talking about 8 to 10 stations, about 2 people per station who can actually, be interacting with the people who are engaging. So it's pretty difficult to find that number, so 16. And then someone coordinating, you probably need a floater. So for the health expos themselves, I would say, at least 16, because some stations don't need 2 people. But yeah, about 16 people.
Don't be misled by Dan saying that our church has 800 people. That's true. Perhaps a third or a fourth of them are active. Okay. Now, you don't need 800 people, you don't need 400 people to do these programs. You need just a few committed people. If you do CHIP, you need one person who will coordinate the kitchen. You need one person who will coordinate all the videos and all. You need a technical person, a computer person. You need a few table leaders, depends on how many participants you have. You need a table leader for maybe 8, one person for 8 participants. A couple of good organizers, and the rest of the people can be anybody in your congregation who are just good support people who will do footwork and help the ladies in the kitchen, or men, or who, and will help serve the food and will help find places for people to park and stuff like that. So you can do it with a handful of committed people. You don't need 50. But to run the Health Expo downtown, we figured we needed 100 people. Easy, 100 people. And we used a lot of churches, 6 churches or something like that. So it's not so much the size of the church or the size of the congregation, it's the number of really, truly committed people that you have. And it doesn't take a whole lot. It takes a few committed people and a lot of helpers.
And how many of those committed people have to be healthcare professionals?
Oh, 1. It depends on what you're doing. But if you have one person, a nurse or a paramedic, or it doesn't have to be a doctor. Doctors probably aren't nearly as helpful as a nurse. Excuse me. Any doctors out there, sorry. But they're too specialized. Doctors are focused. So you don't need a whole million. You just need 1 or 2. Now, before we break, I do want to say something. If you're small, you've never done anything before, and you want to start something simple and free, costs you nothing, costs the participants nothing. One of the first things we did here was our former pastor requested that we do a program on advanced directives. So I printed off the internet. I'm not an internet person. Anybody who knows me will tell you that. But I printed off the internet the forms for everybody. We advertised it to the church. We had a lot of people come, 20 or so people come, and we had a couple of attorneys from our church who came, and the folks, we told them all about advanced directives, living wills, durable power of attorney for health care, all those things. And they had an opportunity at that time to sit right down there and fill them out, and then they would have them. And it was huge. People really liked that. And in addition to doing the activity and getting people involved at the beginning, it gave us a little audience to say, now tell us what else you would like for us to do. And you can get ideas then from your congregation.
I'm from the Delaware Church. My name is Pat Crampton. We've tried the CHIP program and we've tried some other things. What do you do to get the people to come? I mean, we have tried going for our health things, making up flyers and going to all the doctor's offices in town and putting out little flyers. And we get nobody. How do you do this?
We have spent a lot of time and energy and dollars trying to answer that question, and there's only one thing that works, and that's person-to-person invitation. That's the only thing that works. Now, we're going to do another, and one of the reasons why is in our area, and if you don't know, Delaware is only 20 minutes away, but in our area we have huge competition for CHIP, huge. Every major medical center in town has their own coronary health improvement program. And they don't want to talk to you, me. They wouldn't talk to me on the phone, nothing. They don't want anything to do. They have their program, their doctors, their way, don't bother us. And by the time you get Riverside, Ohio Health, the university, and Mount Carmel, and all their affiliates doing all of their programs, you can put 100 signs down on the green and it doesn't matter. So we're going to do one more thing. We're going to use the Health Expo this fall. If we see 1,000 people at the Health Expo, and at the end of the line, when they see a counselor about their results, the counselor is going to have a chance to say, you know, you really ought to think about CHIP. And then we're going to have a CHIP booth. And we're going to see what we can do with that. Because like I say, CHIP is geared to sick people, and you need to have people referring participants to you who are sick. So if you have a doctor in town, a couple of doctors in town that you have a good relationship with who will send you people, that's good. But just to advertise, doesn't get it. Not around here.
And not around any other place. I observed over the years less and less people respond to things that they get in the mail. I personally get bothered and bugged when I see all this stuff stuffed in my mailbox, and I just throw them in the trash basket. But what really will work is, as March said, personal invitation, and be present at these community organized events, fairs. Let the county, let the TV stations, let the community advertise for you. You just be there, present. Put a booth, maybe small, just be present. Just to tell you, even people passing by through your booth, some of them will become your volunteers. During the Health Expo, I had several people, and in particular I remember 2 Catholics. One of the guys came to me and said, I know that you are Adventist, and I always disagreed with your theology, guys, because I'm a Catholic. But I'm so impressed by what you're doing for our community. I want to volunteer. Anytime you just call me, I want to be a volunteer here. You tell me exactly what to do, and I'm going to do it. Well, and we had actually on the line few people who were of other faiths. We had 2 Catholics who were helping. They were doing exactly what we instructed them to do, to time people stepping on the Harvard test. So you can recruit people who are not members of the Seventh Adventist Church, and this is the best way to expose them to Adventism. They're going to eat together during the lunch break. They're going to talk together throughout the day. You're going to make friendship with them. So don't be afraid to enlist people who are not Adventists in the program.
Julian, just a couple of quick comments before I have a question of my own. I'm Pastor Mike Barnett from the Eastwood Seventh-day Adventist Church and the Grove City Seventh-day Adventist Church. I've had the privilege of running a number of cooking classes and so forth, and one that I did in Washington State, we did tag team with an Adventist chiropractor and naturopathic doctor. And it was very successful. He had obviously a large clientele that he could bring and advertise to, and he did, and so we had a great time. Probably 2/3 of the people that would come were not church related and came because of him. When we were here in Ohio in the Defiance area, we had someone right next door to our church who was known as a specialist in nutrition and the healthy end of pharmaceutical stuff. And we actually tagged her in, and she became our presenter of nutritional information. She was not connected at all with the church. And she too brought people to our cooking class. And then, of course, in the local community there, we had a lady, again, not an Adventist, who had, however, received her medical training at Loma Linda. And she actually invited our congregation to present something at a health fair at a local Christian college. And we actually closed down church, and we did church there at their health fair Sabbath morning, so to speak. We ran a booth that easily was the most popular one. We fed everybody who came as well. We had the best giveaways. My wife was connected at that time to a chain of grocery stores and had connections to all the major food distributors. So believe it or not, Dole Banana does make a 3-foot-long plush stuffed banana that children can take home. It's absolutely gorgeous. We got them for free to give away, and stuff like that. Sometimes you can make these kind of connections. Currently, of course, we are operating a cooking class once a month for up until the 1st of June, and then we're going to do it again in the fall. If you can make those kinds of connections in the community, it's good. Eastwood has not done this for some time that I'm aware of, and so again, building up a clientele of participants is always the challenging part. We've done some door-to-door work, and we have received people who've come to our first class that way. But on the other hand, we've also received at least one complaint from people in the community. Flyers that were passed out door to door ended up scattered, to the wind, and that created a mess for some people, and so on. So those are some things you got to take into consideration, even when you do something like that. Then, of course, I do have a specific question. I have been to hear the people who were responsible for Full Plate, as you know, Julian. Pastors got a chance to hear them for a number of hours. But what I don't quite yet myself understand is how they facilitate this more like a book club. I would like to do Full Plate sometime, but obviously it's done completely different than sort of a lecture basis or anything along that line. It seems more like let's get together and be friends, and this is the book that we're dealing with. So somebody address that. How's that worked out?
Well, there's a reading book. I would call it it's a resource book. Then there's a participant workbook, and then there's a leader workbook. And it's like Dan said, they're out there on the table, I can show you, but the leader sits there and reads from the book. Now, part of the thing that makes a Full Plate successful is that you have a leader that doesn't have to stare at the words and read the words word for word, who can, escape that a little bit, but doesn't wander off the subject. There's a kind of a fine line. And in the course of each session, there are exercises to do. I don't mean jumping jacks, I mean workbook exercises. So the leader says, okay, take a few minutes and divide up in pairs. Now, if you have a group of 6, you don't divide up in pairs, you do it as a whole group. But divide up in pairs and do this, whatever it is. And then you come back together as a group and you share it as a group. And then the leader reads a little more, or says a little more, preferably. And then you come to another assignment and the leader says, now divide up in your pairs again and do this. And then you come back to the group and you share it with the group. And that's how it goes.
And how many times do you normally meet to get through the book?
It's designed to be done in 8 sessions. You can do 1 session a week, 2, 3, 4, 8 nights in a row, whatever. It's very flexible. The first time we did it, we had a large group, and we tried to meet everybody's needs. So we had 3 different groups meeting at 3 different times. And when you divide up into those kinds of groups of 7 or 8 people, it's not good because there's always somebody absent. And so then what you end up is a group with 1 or 2 readers or leaders or whatever, and 4 participants, or 3, or, you know. So keep your group big enough. You want at least 10 people. But that's how it goes. And it works better if you can engage people twice a week. You only have to commit them to 4 weeks. It's very, very hard to talk people into coming to 8 sessions. It doesn't matter if it's 8 weeks in a row, or, you know, it's like, look at your calendar, and if you can come for 8 weeks, it's a miracle. It's just whatever works for you in the group, but it's 8 sessions.
Okay.
Now, I want to give you 2 websites before we close. If you're interested in knowing more about CHIP, go to www.adventistchip.com. You can find out everything you want to know there. Click on Facilitate CHIP. It lists all the training workshops for you, gives you some videos for CHIP in your church, all kinds of information about CHIP. AdventistChip.com. If you want to know about Full Plate, there's no www. It's just HTTP. FullPlateliving.org. And there are 2 links in there. One says create an account. I would encourage you to do that, whether you have any intention of doing Full Plate right away or never or ever. Create an account and sign up for the newsletter. The newsletter is really good. It has, and you get it maybe once a week. It has recipes, it has suggestions, all kinds of ideas, what's new with the Full Plate organization itself, and it's free. So you can get a lot of information at those 2 places.
Just since we have Jenny back, we didn't talk about the kids at all. Could you talk briefly about the program you did in conjunction with CHIP, why we did it, how we did it, and how it facilitated the kids while the parents were at CHIP? And then I'll let you have the last question here.
Yeah, just real quick, for our first CHIP program, it was our largest program, and one of the sort of feedback items that we got from a lot of people as we were promoting it was, you know, I would really love to come to your program, but what am I going to do with my kids while I'm in the program, because you're there for 2 hours, it's a 2-hour lecture. I haven't found a 6-year-old yet who wants to sit through a 2-hour lecture about fiber, so, you know, what am I going to do with my kids, you know? So we talked about just offering sort of a child care situation where the kids would just go up in the kids' room and play, but we decided instead to do sort of a kind of a kids version of CHIP. If you're interested in the details, I can absolutely, I found a great program that we used. That was sort of a healthy eating class and a cooking class that we did in our fabulous kitchen here, because we have such a lovely facility. And it was great. So the way we formatted it was every week, or every lecture, when the adults would go to their lecture, the kids would come. We would talk a little bit about a topic, fiber in cereal, and we'd do some activities. And then we'd go to the kitchen and we'd talk about a specific country, and then food from that country, and then the kids would cook a meal with sort of traditional foods from that country, incorporating all of the things that we talked about in our little discussion. So we actually got some kids to eat artichokes, which we were pretty excited about. So it was a really fun time, and I really felt like we got some great results out of it. I know we had some parents saying, what are you guys cooking tonight? And I'm like, oh, we're doing this great thing with lentils and artichokes and green beans. And they're like, my kid's not going to eat that. I'm like, yeah, he is. And of course, you know, if the kids are invested and they're involved in the actual cooking process, it's amazing what they're going to eat. And we had some parents come up to us after the program was over a couple months later, and you know, they said, you know, my kids are still using the stuff that you taught them in that class. We were in the grocery store the other day, and I was going to buy a cereal, and my 8-year-old said, wait, Mom, we have to look and see how much fiber's in that cereal. And so the 8-year-old was actually helping their parents, sort of keeping their parents on task for some of the things that their parents learned in their nutrition class, but also, you know, gave the parents an opportunity to talk to their kids about healthy eating. So I really felt like it really matched up well with that. And so if that's something you're interested in, I have my resources that I used, and I'd be happy to share that with you.
Something to say about this
So something along the same lines, and first I'll start with your question earlier on. There are 2 things. If you want to get people to come to your expos, maybe you need to look at it more as, let me go to them, or let us go to them. So the two things that we have used. One, having someone, that floater I was talking about at any health event, someone who's going out and talking to people, who's just interacting with everyone else who is there, and saying, oh, so this is what we do, and what do you guys do? We've had a lot of our invitations because of other people who are at the health expo saying, oh, please come to our church, please come to our organization and doing this. So you really, just tapping into the community is really important. The second thing is using children, because really, parents don't know what to do with their children if they go to certain places, so keeping them occupied, yes, is very important. But another thing is just, having them do something that's completely engaging and fun, like Jenny was talking about. We have a Children's Health Expo as well that we have started conducting. And so, they'll come and do the same things. New Start, for nutrition, they'll have a food pyramid, and they have exercises that they do, hula hoop, running around, using bouncing balls, but it's engaging for them. But then the adults can also go through their own stations knowing that the kids are also doing something else that is geared towards health. So really important to involve children.
I just had one more quick question about the chip. You mentioned that hospitals and cardiology departments are sending their patients right to the program. What about insurance companies now? Are there any connections with insurance companies with all the new discounts on healthy lifestyles for your insurance?
That's a good question. We have not experienced that. We haven't had people's insurance cover their participation here. We haven't had insurance companies involved here. I have gone to one insurance company and said, hey, we could do this program, and it was like, well, that's nice. So I don't know, but last year. Yeah, things are changing. Things are changing fast. And the focus is on wellness and prevention, and so this is another opportunity for us. So I have not tried out those things.
I don't have an answer, but what you just did, you threw there an amazing idea, and I'm just thinking out loud. What if then, as our health ministry director coordinator of the conference, approaches the president of Ohio Conference and let him talk with the insurance company of all the pastors, because we are insured under the same company, and him encouraging all the pastors to participate, let's say, in a CHIP program. And this way, you'll have one task solved as members of the church. You'll have already on board your pastor.
Because what I'm finding in insurance companies is, even if you don't meet their numbers for healthy and discount, as long as you're in a program working towards it, you can still get the discount.
So which companies do you have in mind? Do you have any?
I'm not sure of all the companies.
Yes.
I just know Blue Cross Blue Shield.
Oh, really? The Blue Cross Blue Shield does that? Good. Oh, this is the insurance company of the pastors. Okay. Yes. Okay.
There certainly is more and more a push to that with the changes in healthcare, as you all know, that are coming very
That's
quickly.
a good idea. Thank you. Thank you very much.
Yes, sir.
I'll go back a little bit to the question that came from Delaware. How to get people to come to attend your programs. I think once you have the exercise done for your church members and they like the idea, they are the people to go out and invite. And their faces will be glowing because they know what they're talking about, other than just giving handouts to church members who don't even know what they're talking about. And number two is to invest in your community if you want the community to be part of your program. The pastor of All Nations Church, Pastor Kwesi, and I have taken time for the last 3 years to really invest in the community around here, attending pastors' meetings. We have an association called Northland Alliance, which is a meeting for all pastors in the Northland area. And attending even their programs, Easter program, Thanksgiving program, so that when we have our events and we ask them to invite their members, they will do that for us. And so investing in your community is one way of having the community also having interest in what you're doing. It's more than what you can do as one person, but that's why we teamwork, you know, community services, health ministry, and all other ministries in the church.
Amen. All right, guys, I'd like to thank the panel very, very much. Oh, we have one more. Okay, well, we'll do one more here. That's all right.
Thank you. My name is Treveline. I'm from Central Seventh-day Adventist. This question about going out to the community, taking the expo to the community, how about liability? Have you thought about that?
Liability, yes. So we have been fortunate because the Columbus Public Health Department has been the one that's helping us coordinate together with the Community Health Advisory Councils. So each side of town, if I could put it that way. So North Side has a health advisory council, West Side has one, and so we use those community leaders to then, invite us. Now, once it comes to the actual expo and the things that we do there, we make sure that we have a disclaimer, and there's a medical disclaimer that they need to sign, especially for the Harvard STEP test. So if you have certain conditions, you are engaging in this activity knowing that there are certain things that can happen. So they have to read through that and sign it, and that absolves us of liability. But there are other things that you just need to look out for that could lead to some liability. Like an example is just standing next to someone who is doing the Harvard STEP test, so that if they do fall, you can catch them. So very simple things, very small things. With the Children's Health Expo, again, we have people who are constantly watching, because it's just really important that you don't get into that area of liability. But the disclaimers, if it's more legal, I think you need to use disclaimers.
Another thing about the liability, before you schedule the event, please call your treasurer or secretary of your conference. I know that you're in Allegheny. Call them and tell them on this and this date we have this outreach event. So what basically they're going to do, they're going to contact the insurance agency that covers the Allegheny West Conference, and they will know about that. And this way, even if something happens, let's say someone falls and breaks a leg, the insurance company will not have any problem, and it will be covered through the conference.
I think at the New Start, it's a good example, because there is official paperwork that you can use for the New Start programs that you can have people sign. And I have examples of that here in the closet. I could show you what those disclaimers look like, and what the forms that we use are that people sign. To some respect, at health community events, there is some liability assumed when someone comes to you and says, please check my blood pressure, please put me in line for this. They're not giving you money for the service, so you're not accepting money in exchange for a service that you're guaranteeing that service. You're simply providing a service to the community for free. And that in and of itself lowers your liability in a conceptual sense, but in another sense, we do have them sign forms as they come through, and they sign into the health fair itself, actually, as they come through. And I can show you what those forms look like if you're curious. It's going to be time for lunch here in just a minute, so amen for that. Let's take about 2 minutes here. We'll get the stage cleared. I'm going to thank the panel. Thank you, guys. I'll give you a paycheck for the same amount that I got for today, for each of you. Don't spend it all in one place. And then we will have a quick prayer to close our service, and pray for lunch. And then we'll go to lunch. So give us about 2 or 3 minutes here. We'll get things picked up, and then we'll go ahead and close today's conference. Okay. Do we turn this back on, Ben? Turn my mic back on. Check, check. Well, guys, I hope that today you will walk away with some high-level view of health ministry, some low-level, like nuts and bolts, how some of these things work and how you can use them. And thirdly, resources around the conference that you can have to help you be successful. Don't be afraid to fail. Don't be afraid to dream big. But start where you're at and build. My information is on the conference website and will be going forward. The email you used today to register, same email that you can contact me at for any questions you have. There will be some presence on the conference, the Ohio Conference website, of health ministry going forward. The next thing you'll see pop up will be the information for the 2014 TIN TV Health and Fitness Expo in downtown Columbus. We'll invite all of you and all of your parishioners to come get trained and then to come help us do this health fair. And you can kind of see how it works and pull maybe some things back to your local community and do some health fairs there. Like I told you earlier, I have a big dream for Ohio. I want Ohio to become the leader in health ministry, not the follower. Right now, there are other conferences around Ohio that are doing really, really well. And we are kind of following in their example. I want Ohio to take the step to be the leader. It's going to take us, it's going to take you, it's going to take us working at the local level to build strong, parish-based programs in health. It's going to take us on a conference level to say, what can we do to really impact the health of Ohio? And it's going to take us working collaboratively to try to build the state up and become leaders rather than followers. I think that we can do it. I really do. Even without a budget, I think that we can do it because it's what the Lord wants us to do. He wants people to live healthy lives. He's just waiting for us to step up and say, let's do it. We pulled off this conference today without a budget. There's no budget for today. We didn't charge you anything to come. There are people that care enough about our ministry, health ministry, to want to help sustain it and push it forward. We're lucky to have a small budget at our church for health ministry, and some of what we're doing today is going to be paid for by that, and then the conference is going to help hopefully reimburse some of that money. That's our intent. That's our understanding with the conference, but you guys know how that goes. If you today would like to give anything to help offset the cost of the conference at all, there will be someone in the back with a basket, a tithe basket, or an offering plate. If you'd like to donate whatever you'd like to help defer the cost, that's great, but you don't have to. This is being offered to you at no cost because we want to start facilitating these kinds of conversations. If you would like to donate, though, we would be happy to use that money to help defer the costs of today. I hope that you will now know that you can call upon the people you've met today and use them as resources going forward. If you have any other questions, guys, I will be at lunch. I'm very excited about lunch. The chef who caters this event is very, very good. So I'm very excited about that. I'm going to go ahead and close with prayer. We've got about 10 minutes, and then lunch will be served in the fellowship hall. So I hope to see you all there. Please bow your heads with me. Father in heaven, thank you for being with us today. Thank you for blessing our event. Thank you for the travel mercies that have guided all of us here safely today. I pray that those that are here, those that are watching at home, those that will be looking at this conference and reviewing it in the months ahead that couldn't be here today, that you would use our time, our efforts, and our abilities and multiply them and bring them together and really carry forward the work that you would have us do. I pray that we would learn from your example to treat people with love first and to help them take a step toward having a healthier life. Thank you for all the things that you have shown us. Thank you for the way you've led us in the past. Please help us to realize that you only want plans that will help us succeed and to benefit us, and that if we work with you hand in hand, we can do amazing things. Amen. Thank you, guys. I think that next will be lunch in about 10 minutes, so take a chance, go outside, stretch your legs, meet us down in the fellowship hall, and we will have a wonderful lunch.